all aging. It's not a bad thing. But it can be scary, lonely, and isolating.
Aging doesn't have to be that way.
Our Geriatrics Workforce Enhancement Program is a project that helps us improve the health and well-being of older adults living in the Kentucky counties of Barron, Bullitt, Hart, Henry, Metcalfe, and Shelby. Since our program's creation, we have formed and maintained numerous collaborative partnerships with primary care providers, area agencies on aging and independent living, and other agencies striving to find ways to help older adults live full and healthy lives. Our team uses a four-prong approach of care coordination, geriatrics workforce education training, grassroots community development, and the creation of Alzheimer's and dementia-friendly communities to achieve this vision of improved health and well-being for older adults.
Flourish, a shared care approach to health care.
The Flourish program delivers free, interdisciplinary, patient-centered care coordination to older adults in our rural areas who have 2 or more chronic conditions. The program seeks to decrease rural Kentucky's chronic disease burden and increase supportive environments. It's organized around the Flourish model of care, which represents integrated, patient-centered, geriatric primary care. It emphasizes collaboration between clinical care planning and community-based care supports, a process facilitated by health navigation. An older adult in need of services can be referred to Flourish by a health provider or community agency. From there, a community health navigator contacts the client, then conducts an in-depth assessment. The community health navigator presents the client's case summary at an interdisciplinary care team meeting, and this team reviews the case and offers recommendations.
It was interesting. The room was full of students and advisors and with different disciplines, which was really helpful, like pharmacy. And they talked about the assessment process that they go through. It's very, very complete.
Our community health navigator helps implement the recommendations with the client and their providers. At 6 and 12 months, the navigator conducts follow-up evaluations that also undergo interdisciplinary care team reviews and recommendations.
When she was having problems, we had to call EMS, and we had to call 3 times in 2 weeks. So we needed to find something around us close that we could depend on. And another thing was we really needed to talk to my mom to find out what she wanted in her last years, days, weeks, or whatever of her life. And so Mona really helped with that, trying to talk to her and figure out what her wants and desires were. Because even, for example, the other night, I was so close to calling EMS because I thought my mom was really on the downswing. And I called Mona, she calmed me back down, and she says, okay, what does your mom want? We need to do her wishes. And I calmed down, and I said, okay, all right, I'll wait another day and see how she was. And it was best, you know. And I didn't know. I'm not, you know, I don't have any kind of nursing experience, so I didn't know what to do. So the Flourish has been perfect for us.
I know when I first saw it, I was really surprised and thrilled that they had this set up so that we were concerned about what the caregiver is going through.
Oh, right.
Yeah, that assessment is pretty deep. You know, how are you feeling about all
Exactly, yeah. And after 2 weeks, I mean, I was wore down.
Because we had no idea that the programs were available to people like my husband and I. And they helped us in so many ways. And the new pharmacy we have, we love those. I could never imagine a pharmacy now delivering our medicine as far out as we live, but they do. They're just super, you know. If something hits my mind, no matter what day of the week it is, and the only way I'm going to be satisfied, I call Megan or Leanne, And if they're busy, I leave them a message. They get back with me before the day is over. So they're great.
ICOA, Interprofessional Curriculum for Care of Older Adults, a Flourish model curriculum.
ICOA seeks to educate a workforce to meet the healthcare needs of an older rural population with a variety of challenges. Designed for students, fellows, and residents from medical, nursing, social work, pharmacy, dentistry, and law. Professional healthcare workers and community organizers also join the program as learners. The modules address critical geriatric content such as interdisciplinary care coordination, palliative care, motivational interviewing, diabetes, and Alzheimer's disease and related dementias. ICOA consists of 5 online didactic modules: geriatric rotations, critical reflective writing, and in-person case-based learning sessions.
As a representative of KIPTA, the Area Agency on Aging, I find it really useful to educate students about the Aging Network and what we do in our community and in the state, and then also nationwide, because we exist as a national network.
I'm from New York, so a little out of my comfort zone here. I think some administration from the hospital were here, our faculty, some of the attendings. We all participated in actual different characters within the module that we were doing, which was fun.
Yeah, I mean, I learned a lot about hospice care. I remember the module that addressed hospice care was really, really informative for me because I haven't worked around a hospice before, about how to support a family that is thinking about hospice and how to frame a conversation in an open way, so they have all the information. That module was specifically useful for me because it filled in gaps that I didn't know.
Our curriculum isn't just for student learners. Members of the existing geriatrics workforce can enhance their knowledge and skills using our curriculum while earning continuing education hours.
KCHC, Kentucky, Coalition of Healthy Communities.
KCHC is a community-based coalition that seeks to develop the social networks and resources needed to promote geriatrics workforce development in rural communities and to increase the community supports that help older adults lead healthier lives. Our team takes a proactive approach to strengthening the community care plan of the Flourish model of care.
Well, there are limited resources in the rural areas, whether it be Meals on Wheels, or it's adult day health services, or transportation. And there are many, many other things.
Well, if they don't have a ride to the grocery store, or if they don't have the resources or the funds, then we need to focus on figuring out how to get them the resources to be able to buy those healthy foods.
Building community resources and networks in rural counties is essential to the long-term success of our clients and communities. KCHC brings together stakeholders to organize activities related to the health of older adults. Memory 360 is our program's initiative to create Alzheimer's and dementia-friendly communities. Memory 360 generates and disseminates Alzheimer's and other dementia-related resources to rural communities. It conducts outreach to local city officials to advocate for the implementation of dementia-friendly communities, working with the police, EMTs, library staff, and chambers of commerce in rural counties to help implement dementia-friendly practices. Memory 360 also offers individual and caregiver support services, such as customized education, counseling, and resource connection for persons facing the challenges of Alzheimer's and other dementias. We decided that the best way to start advocating for dementia-friendly communities was to collaborate with KCHC. The collaboration between Memory 360 and KCHC has enabled us to conduct interactive dementia simulation events in the community and has put the Institute for Sustainable Health and Optimal Aging within the public's reach as a resource to call for seeking help with dementia-related topics.
It was easier for me to understand the daughter's perspective. I have a grandmother who has Alzheimer's disease, so it's sort of, well, for me, it touched close to home. I don't know. I think it's just the idea of bringing into the picture of a patient's care every aspect in their life is 100% important to having them be treated properly.
He's got Alzheimer's and then he's got it bad. One night he was getting out of the bed and I told him to lay down. He said, I can't lay down because I'm going to open the gate and let these cows out. He thought they was in the bed with him and he's turning the sheet back to let the cows out.
So speaking just from a learning perspective, my experiences with the online modules were incredibly helpful. Was complemented what I was learning in my classes with care coordination and critical aspects of health of older adults.
So I work with a lot of uninsured folks and a lot of folks who speak Spanish as a first language and have different levels of English proficiency. So I think there's a lot of helpful pieces to the Flourish program for those folks because, one, if you're uninsured, even if you are insured, the healthcare system is so difficult to navigate in the first place. And if you're uninsured, it's even more difficult to navigate because resources are so much more limited to you. I was working with a client who has been struggling with PTSD for a lot of her life and hasn't been seeking mental health services. Recently, we were able to track down a Spanish-speaking therapist who will go to her home and do therapy with her in her home. So that is going to be a huge step forward for this client.
Every 2 or 3 months, it keeps that patient out of the ER. So it decreases healthcare dollars. It's better for the patients, and it's better for me. I mean, this is my favorite part of my job. I really get to know these patients and love them.
Because they always see stuff that maybe we don't see. We're looking at them medically, and they're looking at them socially. It's been a wonderful, wonderful project.
Well, sometimes it can just be as simple as going into a client's home and maybe they need rails in their bathroom or maybe they need a hospital bed.
How can I support you? How can our team support you? How can we find these resources for you so that you can breathe again and start healing?
She's very sweet. She helps me because my stroke that I had, I just don't think like how to take care of these programs and paperwork because she can ask me again and I can't remember. So that she's not going to steer me wrong.
It helped me, quite a bit because, I couldn't do it all by myself. I appreciate everything they have done for me.
Many people in our community has talked very highly about this model, speaking about the value of the model in engaging with older adults to keep them healthy in their communities. All of this we have nested within the development of a very strong supportive community through the Kentucky Coalition for Healthy Communities. This coalition now spread beyond the 6 counties we serve. We do a lot of trainings related to motivational interviewing, how to deal with your medications, how to eat healthy, how to exercise, how to really figure out how to live within your community while you age. This has been a very forceful program in creating an environment of support for our older adults.